So this is our first lecture on our Introduction to Physical Agents. You may also hear it referred to as modalities. That is what we will be focusing on in this class this semester. The main objective of this lecture is to identify different categories of physical agents and discuss their role in rehabilitation in the field of physical therapy. I know you don't have your textbooks yet, however, when you do receive them, just note that Chapter 1 focuses more about the physics behind the physical agents. We will be talking about that a little bit, but mostly focusing on the effects on our patients. So what are physical agents? Physical agents are defined as the energy and materials applied to patients to assist in their rehabilitation or in the rehabilitation process. I would say your physical agents include a variety of treatment tools that are used by applying energy and different materials. Our ultimate goal is to decrease inflammation and pain. We also want to strengthen our patients. We also want to relax the tissues and allow the tissues to heal. Again, this is often referred to as our modalities. Some examples of physical agents include heat, which could be our hot pack, our paraffin; cold, which could be our cold pack, our ice massage. We could use compression, we can use water, sound, electromagnetic radiation, electrical currents. There are a variety of different types of physical agents that we can use. The different categories of physical agents. I like to break them up into three main categories: our thermal, our mechanical, and our electromagnetic agents. Your book classifies these modalities based on the form of energy. So we're going to start with talking about these three different forms, and then we'll talk about a few others. So your thermal agents. So we can essentially apply heat either deep or superficially. We can also apply cooling, but cooling we can only apply at a superficial level. We can't apply cooling to a deeper level to the tissues. Our mechanical agents, this includes traction, so mechanical traction, compression. We can use water and we can use sound. And then our electromagnetic agents, these include anything with any type of electrical current or electromagnetic types of fields. So one thing I want you to keep in mind is that even though we've broken it up into these different categories, is that some of these physical agents may fall into several different categories. For example, if we're using water and also talking about our ultrasound, both water and ultrasound can have mechanical effects, but they can also have thermal effects. So they're often categorized in several different ways. As I mentioned, your textbook, once you do receive that, on page 4, there's table 1-1, they classify your modalities based on the form of energy that is being used to provide this physical agent. So as I mentioned, we're going to start talking about the electromagnetic, the thermal, and the mechanical first, and we'll also get into electrical and sound energy. So starting first with our thermal agents. Thermal agents transfer energy to a patient to produce an increase or a decrease in tissue temperature. And I like to think of this as two different categories. So we have cryotherapy and thermotherapy. Okay? And then we can also apply our thermal agents either superficially or deep, depending on what our target tissue may be. So when we think of cryotherapy, I always think of a decrease in our tissue temperature. That's essentially what the goal is. So some examples of this could be an ice massage, cold pack. We can even do a cold whirlpool where we have the water is cold and the ice is cold and then the water's moving around. There's a cold spray. You can use a contrast bath, ice immersion, cryo cuffs. There's also something called cryokinetics where the patient is actually doing exercise while using the cold modality at the same time. So as you can see, there's a lot of different examples of cryotherapy. Thermotherapy, this is when we're producing an increase in our tissue temperature. And what I want you to remember is that these changes in our tissue temperature are temporary. They're not long-term. They're not long-lasting. So the way that we would do this with thermotherapy, we could use a warm whirlpool. We can use our hot packs, which we refer to as moist heat, okay, because it does use moisture. They do rest in a hydrocollator filled with water. You can also use something called a paraffin bath, where we have paraffin wax that gets heated up, and then we usually will submerge a part of the body into the paraffin. You can probably guess that we typically only use this on hands and feet, distal extremities, because it is not possible to immerse all parts of the body within our paraffin bath. And then we can also use something called fluidotherapy. I don't want you to get caught up in all of the different types of therapies yet. We will get through that as we go through the semester. So I want to kind of touch on the goals or the physiological effects that are occurring with these different modalities. So with thermotherapy, our goal is to, or the effect of our physical agent is to increase circulation to that part of the body, to increase the metabolic rate, to increase the soft tissue extensibility, and decrease pain. Soft tissue extensibility, I think of that as the elasticity or the flexibility of the tissue. So we're trying to increase the length or flexibility of that structure where we're applying our thermotherapy. With cryotherapy, we end up getting a decrease in circulation, a decrease in metabolic rate, but we're also still again decreasing pain. So if you look at our thermal agents here, whether we're using thermotherapy or cryotherapy, we will have an impact on pain. However, it works, the physiology behind it is slightly different, and we will get into that in the next few lectures. Moving on to our mechanical agents, the goal of our physical agents with this mechanical property is we're using a mechanical force to either increase or decrease pressure on the body. And how we decide that, again, we will get to that later on in the class itself. But we can do this through water, so hydrotherapy. When you are submerged in water, the water does apply a compressive type of force, and that can actually be very beneficial for patients. Traction is another example of a mechanical agent. Compression, so we can use compression wraps, compression braces. And massage, which we often refer to as soft tissue mobilization, is another way to increase or decrease pressure. Moving on to our electromagnetic agents. With our electromagnetic agents, that uses an electromagnetic field or some type of electrical current, and the goal is to promote a change in the tissue. And we can do this through UV radiation, through infrared radiation, IR radiation, laser, diathermy, and electrical current. I will say out of all of these, you will most commonly see electrical current. Some of these other examples are not as commonly used in all physical therapy settings, and some may be used more in one setting than another. I really like this picture to kind of help visualize the different types of electromagnetic radiation. I think of this middle portion here, the visible light. These are just the color spectrum. This is what we see. I know a lot of those terms up there are infrared radiation or UV radiation. They are on the spectrum of our electromagnetic agents. So our UV radiation, okay, you can see the wavelength is slightly different compared to our infrared radiation. So our UV radiation has a higher energy compared to our violet lights, whereas our infrared radiation has lower energy than our red light. Moving on to our electrical agents. Electrical agents cause a chemical or a thermal change to the tissue that is caused by some type of electrical current. I know we've already talked about electrical current within our electromagnetic agents, but like I said, oftentimes our modalities fall into several different categories. So specifically our electrical agents, examples include our electrical stimulating currents, biofeedback, and iontophoresis. Our sound agents. These use sound waves that are produced and transformed from high-frequency electrical energy. So Sound energy consists of pressure waves due to the mechanical vibration of particles, whereas our electromagnetic radiation that we talked about is carried by our photons. These sound waves, they travel at the speed of sound, whereas electromagnetic waves travel at the speed of light, so they travel much faster. Our sound waves travel much slower. One thing I want you to think about, the more rigid the medium, so the medium is the portion where the sound waves have to go through, so the more rigid the medium, the greater the velocity of the sound will be. So that means that sound waves that have a greater velocity of transmission, this will occur greater in bone compared to fat. So if we're trying to send a sound wave through a bone, there's going to be a greater velocity of transmission. Okay, so that's going to be really important when we talk about parts of the human body that we're applying our sound waves to. You've already talked a little bit in Intro to PT about the history of our physical agents. If you remember talking about torpedo fishes, how they were used to treat headaches and arthritis. If you remember the Greeks and the Romans, they used their hot and cold baths. When we think about the way that these modalities have changed over time, I think our technology has allowed them to progress in a more advanced way over time. One of the biggest things I want to stress about this class, and I will probably repeat this over and over and over again, is that physical agents are a set of tools in your toolbox that you will use as a physical therapist assistant. Physical agents are not the only treatment. They are a tool in your toolbox. Okay, they're not the end-all be-all of treatments. The reason why I stress this is because many patients really like physical agents because they feel really good. However, they don't typically fix or resolve the underlying cause. They don't help resolve impairments or limitations that patients have, but patients like them because they feel really good. So what I want to read to you, what I have on the slide here is specifically from the APTA, their statement in 1995. So without documentation that justifies the necessity of the exclusive use of our physical agents or modalities, the use of these physical agents or modalities in the absence of other skilled therapeutic or educational intervention should not be considered physical therapy. So essentially they are saying by solely using physical agents without justification for it in your documentation or without any additional skilled therapeutic intervention are not physical therapy in and of itself. Okay, so the use of physical agents alone is not effective management of your patients. This is also available on Blackboard in the Week 1 folder. I want you to take a look at this. I will have copies for you guys to see later on in the week. But what this is a statement, again, by the APTA talking about this specific one covers 5 things that physical therapists and patients should question. But number 1, I think, is the most important, saying don't use superficial or deep heat to obtain clinically important long-term outcomes in musculoskeletal conditions. Essentially, they're saying there's very limited evidence or research on the use of superficial or deep heat to obtain clinically important long-term outcomes for different musculoskeletal conditions. While there is some evidence of short-term pain relief for heat, the addition of heat should be supported by evidence and used to facilitate an active treatment program. I cannot stress that part. An active treatment program. Okay, a carefully designed active treatment plan has a greater impact on pain, mobility, function, and quality of life. There is emerging evidence that passive treatment strategies can actually harm patients by exacerbating their fear and anxiety about being physically active when they're in pain, which will prolong their recovery, increase costs, and increase the risk of exposure to invasive and costly interventions such as surgery or injections. So the APTA is strongly saying that the use of superficial and deep heat long-term will not have a general effect on our patients. And I think this is really powerful because it talks about the lack of evidence that is available for these different conditions. As I mentioned, this document is available on Blackboard. I highly recommend reading through the rest of the items that they have listed here because they are definitely going to be important for you to reflect on as you progress through the program.